I'm Dr. Radhika, a gynecologist and infertility specialist from Institute of Women Health and Fertility. Infertility, almost in about 10 to 15% of couples trying for pregnancy are facing a problem with conception. This is almost in a rising trend that nowadays almost 1 in 6 to 7 couples have problem in conception. When do we call it infertility? Infertility is nothing but when a couple had been trying to conceive without any protection or without any means of protection for almost 1 year of unprotected intercourse, we call it infertility. Let me just explain how an infertile couple is taken through in an infertile clinic. During the first visit, the couple is analyzed and they are taken a detailed history as to what is the cause of infertility, what is the duration of married life for them, and what is the age of the couple, that is age of the female partner and the male partner. Had there been any pregnancies in the past, that is there any miscarriage in the past? Once the examination and history is taken, we go for a workup of the patient, that is we see for the ovarian function to ensure that the ovaries are functioning well, that is ensure that ovulation is going on fine. We also look for tubal factors. Tubal factor analysis is done by a test called salpingogram or a hysterosalpingogram. If there is any problem with the hysterosalpingogram, that is tubes are looking blocked, then we analyze with a further test, further surgical assessment like laparoscopies. Once the tubes are cleared, we also analyze how the uterus is with the hysterosalpingogram. And as I already told you, male factor is analyzed by semen analysis, simple semen analysis after an abstinence of 2 to 5 days. Once all these are ruled out, we get to analyze or we get to reach a conclusion as to what may be the probable cause of these infertile couple. There may be few factors like peritoneal factors, like in endometriosis. We have the endometrium or the inner layer of the uterus growing elsewhere outside the uterus. That is, the inner layer of the uterus or the endometrium may grow in the ovaries, may grow in the pouch of Douglas, that is behind the uterus, or may grow near the tubes. These all cause a addition or attachment of the uterus and the tubes, and they impair the easy pickup of the ovum or the egg from end of the tube to the medial end, that is the inner end of the tube. Then there is no egg pickup, there is no pregnancy. So most of the times with simple infertility treatments and simple infertility counseling, how they have to go about with a natural conception, when they have to try, when the egg is being released, with all these things itself, 70% of the couples would conceive. And only in about 10 to 15% we go to the next step like IUI or further step like test tube baby procedures. IUI is intrauterine insemination, where the sperm sample is collected in the laboratory. It is washed off the impurities and the good motile sperms are injected into the uterus through a thin cannula or a catheter. These sperms have to traverse a very short distance from the uterine cavity into the tube where the egg is already picked up and stay. So this distance to be traversed is very short, thereby increasing the chances of pregnancy. IUI is of major benefit in minimal or mild male factor infertilities. Once we've seen that other factors are also ruled out, ensured that everything is fine, then we counsel the couple for IVF or test tube baby procedure. IVF is in vitro fertilization. What we do in this one is we give injections or continuous injections to the lady, which will cause superovulation. Once the eggs attain a mature size, we collect all of them through a thin needle into the test tube, washed off the impurities and then incubated. The same day, same time sperm is collected in the laboratory. The egg and the sperm is inseminated together and embryos are grown in the laboratory. Once these embryos are grown, they are pushed back or they are transferred back into the womb using a thin catheter, that is the embryo transfer catheter, after 48 to 72 hours usually, or even after 5 days sometimes. But in few men or few couples, The problem is with the severe male factor infertility. That is, we find only few sperms, or in the ejaculate we find only few sperms, or sometimes not even a few sperms in the ejaculate. In that condition, we can surgically aspirate the sperm from the testicular tissue and see if it's already there. Once we get a good sperm from the testicular tissue, we inject that good sperm into the cytoplasm of the egg so that we have maximum chances of fertilization. This particular process is called ICSI, or intracytoplasmic sperm injection. So this increases the chances of fertilization, and this further increases the chances of pregnancy also. Yeah, that's it about infertility overview. Thank you. And if you have any issues regarding infertility or regarding counseling about how a conception occurs or how to go about trial for pregnancy, you can visit us.